So we welcome you to another live session on cataract surgery. As you know, we are doing this because this month is the Cataract Awareness Month. And today we are talking about the advancements in cataract surgery techniques. I'm Dr. Tushar Grover. I'm a medical director and a consultant in cataract, cornea, and refractive surgery at Vision Eye Center. So let's start. So many of us know that cataract surgery today is extremely different from how it used to be. Here, we used to need to open the eye with a big incision, about at least an 8 to 9 millimeters incision, remove the lens, put multiple stitches. Visual quality was not extraordinarily good. People needed big sized, fat spectacles after cataract surgery to be able to see clearly. There was a high risk of infection. Today, all of that has changed because cataract surgery has become extremely advanced. We have now reached a stage where we don't need to give any injections for cataract surgery in most cases. The incision, the entry into the eye that we make is about 2 millimeters, which means it's extremely small. And this avoids the need for any stitches to be placed in almost all cases of cataract surgery. It also improves visual outcomes quite a bit. The recovery is extremely fast. The chances of infection are lower. So that is why cataract surgery really has reached an extremely advanced stage today. So we'll discuss that and we'll take some questions and we'll be answering those questions. Any doubts that you have, anything that you would like to know about cataract surgery today and the advancements that have happened, we'll be able to take up. So we have a first question. The first question is about femtosecond laser assisted cataract surgery. So some of you might have heard about the use of these lasers in cataract surgery. Now this is a relatively new development, has been around for the last 6 to 7 years now and is gaining popularity. It is quite widely available now. The benefits that this has is added precision to the surgery. So a lot of steps that you would need to do as a surgery, the lens of the eye, making small fragments of the done by the laser itself. So what that does is it adds a lot to the precision of the surgery. An opening that you would want to be exactly 2.2 millimeters can be produced in the exact same dimensions by the femtosecond laser, which even a completely and extremely experienced and trained surgeon cannot do. You cannot have the exact size of the incision up to microscopic, millimeters that you can have with the femtosecond laser. Even the opening to the eye, if you want it to be 5 millimeters, it is going to be exactly 5.0 millimeters when the femtosecond laser does it. So the surgery essentially is the same surgery being done. You're using phacoemulsification ultrasound to emulsify the lens, break it into smaller pieces, and aspirate it inside the eye. But the precision levels are higher in femtosecond laser assisted surgery. That is why it is gaining popularity. That is why patients are demanding it. And that is why it is probably the way forward in cataract surgery. The next question is, does cataract surgery require stitches? So, like I said, in most cases now, with the advanced techniques that we use and the advancements of technology, the entry that we make into the eye, the incision, the cut that we make is just about 2 millimeters, a little more than 2 millimeters. Now, because of that, you do not require stitches after cataract surgery in almost all cases. Because the wounds are so small, they heal by themselves, they seal by themselves after surgery, and therefore there is no need to put any stitches in cataract surgery in most cases today. The next question is, will I have to receive injections to anesthetize the eye before cataract surgery? So again, injections are usually not required in cataract surgery now because the technology is so advanced. So all we do is we put a drop of anesthetic to numb the eye so that you don't have pain during the surgery. And after that, all you need to do is to keep looking at the light in front of you, and the surgeon can perform the surgery without any discomfort to you. There are a few exceptions like extremely hard cataracts, or suppose the patient is not very cooperative, is hard of hearing, is not able to hear the instructions carefully. In those cases, the surgeon might choose to give an injection to anesthetize the eye before cataract surgery. But in nearly all cases, the need for injections is now gone, and we just need to use anesthesia drops before cataract surgery. Any other questions that we have? Okay. So the next question is, do I need admission in the hospital after cataract surgery? When can I go home after cataract surgery? So today, cataract surgery has essentially become a daycare surgical procedure. What that means is that you will be called to the hospital maybe an hour before surgery. Your eyes will be dilated using drops. The surgery will be done, usually takes about 10 to 20 minutes for the surgery to be completed. After that, within an hour or so that just so that we can ensure that you're comfortable, you can be explained all the medications that you need to use, we let you go home. So on the very same day, within an hour or so after the surgery, you can be allowed to go home after the cataract surgery. So essentially, there is really no need for any admission in cataract surgery today. The next question that we have is, are there any advancements in intraocular lens technology for cataract surgery? So there are multiple advancements in intraocular lens technology for cataract surgery. The kinds of intraocular lenses that were available a few years back was extremely limited. You just had one kind of lens which was implanted in everybody, which took care of distance vision to a great extent, whereas for near, you needed to wear glasses in all cases. Now there is a huge variety. There are lenses which are able to cover your vision for distance, intermediate, and near without any major dependence on glasses. There are also the kinds that give you good intermediate and good distance vision. They also have an extremely good quality of vision. There are what is called aspheric lenses which improve the quality of your vision. These are usually hydrophobic lenses, so there is no deposition of any cells around the lens. So there are tremendous advancements in the technology for intraocular lenses, and you have a huge range of choices available to choose from when you undergo a cataract surgery. And your surgeon and the counselor who's advising you about the surgery and explaining the details of the surgery will guide you and will share these options to you. And it is really up to you in most cases, based on your occupation, based on your requirements, based on your lifestyle, which lens you want to go for. So a huge range of options that are available now. The next question that we have is, can you explain the difference between traditional cataract surgery and advanced techniques? So, cataract surgery used to be extremely different of a couple of decades back. We used to remove the whole structure of the lens. We used to make a big incision, open the whole eye, remove the whole lens, and then stitch the eye. And then the individual had to wear those big fat lenses in their glasses after cataract surgery. So it required those fat glasses which had a power of about +10 +11 diopters. Today, it is extremely advanced with very small incisions. Like I said, you enter the eye, break down the lens into tiny pieces inside the eye itself, and using ultrasound laser, you aspirate it and you place an artificial lens. The bag, the whole outside structure of the lens is still retained, and the inside contents are removed. And in that same whole structure, in that same bag, you place an artificial lens, which gives you extremely good vision and eliminate the problem that you had because of cataract. The lenses today are also able to give you extremely good vision without glasses. So in most cases, your dependence on glasses is minimal. It is not that every case has a power of zero point 0.0 diopters, but in almost all cases, the dependence on glasses is minimal. So the next question that we have is, should I wait for the cataract to ripen or fully mature before undergoing cataract surgery? So yes, this is extremely important to discuss in today's times with the advancements that I discussed. Like I said, we make an excision extremely small entry into the eye. We break the lens into tiny pieces and then aspirate it inside the eye. And that is why it is important not to let the cataract ripen or fully mature, because once it is ripening or becoming mature, it also becomes extremely hard. That is why, with the current technologies, to break down the lens into tiny pieces, you need a lot more energy, which can cause more swelling to your cornea, which can cause more discomfort to you, and it also increases the risk of complications a little bit. That is why the right time to do cataract surgery is when the cataract has started interfering with your routine activities a little bit. That again varies from individual to individual. Somebody who's, for example, an occupational night driver will have symptoms much earlier. So, in those individuals, an early cataract can be ignored and we can wait for the cataract. Sorry. So if somebody is an occupational driver, they're likely to have symptoms much earlier. So in those, an early cataract also needs to be taken out early. Whereas, say, somebody who's a housewife may not be feeling symptoms of an early cataract right away. So for somebody like that who's occupationally working at home, doesn't have too much screen use, you can wait a little bit and let the cataract get a little more advanced. You should still not wait for it to ripen or mature. So the timing for cataract surgery depends on your occupation, depends on your lifestyle, and as soon as it starts interfering with your lifestyle, it is the right time to do cataract surgery. The next question that we have is, I have a high cylindrical power along with a cataract. Can my cylindrical power be corrected by cataract surgery alone? Yes. So that is an option that we have now. So if you have a slight cylindrical power, it can just be corrected along with femtosecond laser assisted surgery using what is called arcade incisions. So these incisions are placed on the cornea in such a way that they correct your cylinder. If you have a high cylindrical power, like this individual has mentioned, you have the option of what is called toric intraocular lenses. So these lenses are specially designed based on the cylindrical power that you have. So once the cataract surgery is done, instead of placing a regular lens, a regular intraocular lens, you place a toric intraocular lens. And that is customized to your power and it corrects your cylinder as well. So even those high cylindrical power glasses that you've been wearing pretty much your whole life can get eliminated and removed to a great extent because of the cataract surgery that you get done. The next question is also extremely important. Is the risk of infection after cataract surgery lower with advanced techniques that are used in today's times? So, yes, with the advancements in cataract surgery, because our incisions are so small, the chances of infections going into the eye are much, much lower than what they used to be. So, therefore, the risk of infection is now reduced to one in many thousands. And that is an extremely, extremely good achievement that has happened because of the advancements in cataract surgery that has made cataract surgery a lot safer, and therefore it is, much easier for an individual to get back to their lifestyle, to be able to wash their face again, to be able to wash their head again. You need to take precautions for a week, but after that you can pretty much get back to your normal lifestyle. The next question that we have is, I have a cataract in my eyes, but I have also undergone LASIK surgery 15 years back. Is cataract surgery safe for me, and are there any special precautions that I need to take? So yes, if you have undergone a LASIK many years back, like any other individual, you can still develop a cataract. A cataract is an opacification in the lens of the eye, and that needs to be removed by a cataract surgery. It can be done even in individuals that have undergone LASIK. The only thing that is important is that you should inform your treating surgeon that you've undergone LASIK, because the calculation of the intraocular lens power is done accordingly. So we use various formulae to calculate the power of the lens that is implanted into your eye. The formulae that are used are different for individuals that have undergone LASIK surgery. Once those formulae are used, the results are as good as any eye. So all you need to do is inform your treating surgeon that you had undergone LASIK in the past as well. So I don't think we have any more questions. So we conclude this session. It was really nice that we got to talk about these changes in cataract surgery in Cataract Awareness Month, and I hope we have contributed to the process of creating awareness on cataracts and on cataract surgery. So, just to sum it up, cataract surgery today is extremely advanced. There are a whole range of innovations that have happened, whether it is in terms of the surgery itself or in terms of the intraocular lenses that are used, that help give us extremely good visual outcomes to patients who are undergoing cataract surgery. We have been able to make cataract surgery much safer. The risks of infections, the risks of other complications has reduced tremendously, which has made cataract surgery probably one of the safest surgeries that can be done on the human body. So, if you have a cataract, don't be worried. Discuss the benefits and the risks with your treating surgeon, and we wish you the best. So, thank you for joining us, and it was really great having you on this live session.